Hey guys, welcome to Thrive Bites, the official podcast of Dr. Colin Zhu, aka the Chef Doc. On every episode, I talk with health and wellness experts from all over the world, such as doctors, chefs, dietitians, coaches, and many more. And I sit down with them and have casual conversations about plant-based lifestyle, how to elevate our emotional resilience, and what it really means to thrive. And I bring all of this to you. So let's get to this week's episode. So we are on air. I'm going to put on some sound effects. Wait for it. Did you hear that? This is great.
The crowd goes wild.
I know, the crowd goes wild. All right, so we are going to start. We are on air right now here at Thrive Bites, made possible by Podbean. I want to thank my podcast hosting and thank you so much for coming on to the show, my good dear friend Rob Graham. So for those of you in the audience, whether live or later on that's going to listen on, this is not part of the regular Thrive Bites season. We're currently in season 2 right now, and obviously we decided to make a new on-air live show just to discuss what's happening in our current environment right now with the coronavirus. Today is March 24th, Tuesday, currently 6:05 Pacific, 9:00 Eastern, and I have Chef Dr. Rob Graham, who is a dear friend, and he's also my very first guest when Thrive Bites actually launched. So thank you so much for coming on.
Yeah, I love to kind of Christian podcast and special edition podcast. So I thank you for the opportunity, Colin. And it's always so good to reconnect with each other.
Yeah, definitely. So I'm super excited as well. Unlike the regular season, I usually have a lot of things scripted, prepared, and we have more of a structure. But I decided that for the very first on-air live series about COVID, the pandemic that we're having right now, that we're just going to be a little bit more off the cuff, and you agreed to be as such. So we're just going to have fun with this and just kind of do our part as healthcare providers to people that are out there, whether home isolation, quarantined, or just pretty much having more time, more space, inside, whether it's in the physical space, but also addressing their internal world. Because right now, I think the last time that I checked the Johns Hopkins, map for all the active COVID-19 cases, we have about 420,000 confirmed cases, and I think about 18,615 currently at this moment, which is really, really sad. And, obviously people are going through increasingly amounts of mental health issues and emotional health. And, we want to be able to address that. We want to be able to, reassure people, give people a little bit of peace, and kind of offer our individual perspectives and our collective perspectives on how to improve our overall wellness, from our experiences, going forward. So just to kind of introduce yourself, remind old listeners who you are, who is Dr. Rob Graham and where are you calling from right now?
Sure. Well, thank you again, Colin, for this opportunity. Interestingly enough, we both sit in two of the hot spots of our country. And I think I hope to offer a unique perspective. And so with that, I'll just introduce myself a little bit. So, as Colin mentioned, I am a board certified physician, both in internal and integrative medicine. I've been doing integrative, holistic, functional medicine for about 15 years. Had the great opportunity of going to Harvard Medical School at the beginning of this movement of integrative medicine back in 2003. I learned with the best. But also, what's really important to highlight, especially during this time, is that during my fellowship in integrative medicine, I obtained a master's in public health from the Harvard School of Public Health. So I, again, offer a very unique perspective because I'm still a practicing physician at FreshMed NYC, Fresh Medicine in New York City, which I do about 50% of my time. I hope to be in business after this whole episode of coronavirus waves through. But I've had the great opportunity of consulting and working with city officials here in New York City over the past 2.5 weeks as the public health scientists and researchers are starting to mobilize all their efforts into New York City. And as someone who's been married for almost 20 years now, I listened to my wife who said, you need to get onto telemedicine at the beginning of March, where we started seeing this virus, this novel virus, which, we can dive into that too, what that means, kind of coming across from China to Italy, and then unfortunately settling in Seattle, but then really, 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 really exploding in New York City. I had the great fortune of working with the Brooklyn Borough President, Eric Adams, who I think is someone who you should watch, and on calls with him, talking about telemedicine and what I think we have to do today. And I'm still fielding calls on telemedicine. Thank God we have that platform to offer our patients access. And in fact, Colin, just before we got on air right now, I just got an email from someone. So right after this, I got to jump on a telemedicine call about a man who works in a grocery store chain called PSK Supermarkets. I've had the great fortune of their CEO, Dan Katz, kind of hiring me on to be their on-call doctor. And we got this guy who's 52 years old, recently diagnosed with diabetes in August. And as you know, Colin, through lifestyle medicine, we were able to reverse his diabetes from an A1C of 13.1 to an A1C of 5.9 within 6 months by adopting, what we call the fresh model of healthcare, which is food, relaxation, exercise, sleep, and happiness. We call the Fresh Five.
Yeah. That's awesome. There's so many points to jump onto this. And I know that individuals, families, small business owners alike are definitely hurting. You can see that the economy has tanked, the stock market has tanked, just globally, we're just really, really hurting. Let's kind of go back to basics because you're definitely a basics, type of guy. And I think we need to kind of figure out, what is a virus, right? Not to go too much into microbiology, but I think a lot of people don't understand the differences between like a virus, a bacteria, or like a fungus, for example, right? So what exactly is a virus and how is it, exactly transmitted?
Yeah, so viruses are, a type of infection. And there are many different types of viruses. This one in particular is what they call an RNA virus, which is the most common. Most viruses are highly contagious. And I just want to pause a second because I also want to recognize the fact that we are in the midst of the flu season, which is also a virus. And I think we have to remember that to our listeners out there, that not all cough, sneezing, runny nose, fevers is COVID. And, viruses are highly contagious. Most of them are spread via what they call droplet exposure. That's why it's really important when you do have a quote unquote cold, which is predominantly viral in nature. You have to cover your mouth when you cough and or sneeze, because that's the number one way that others can get infected.
Right.
Really important factor here, because I get a lot of phone calls, and I know we're supposed to make this back and forth, Colin, and I know you're a doctor, you practice as well, is that many patients have been calling because they want an antibiotic for this cold or flu or virus.
Right.
Traditionally, which is really interesting to talk about because as you're seeing, one of the emerging therapeutics is an antibiotic as well as an anti-malarial drug, which is really interesting because traditionally antibiotics don't have any sort of effect on viruses.
Hmm.
So it's kind of an interesting perspective to think about as well. They're typically acute infections. They're short-lived. They can last weeks, but they're really, really, really potentially deadly in patients and people who are older as well as with chronic diseases.
Yeah, yeah, definitely. And the thing is that, similarly, for those of the audience that are, new to me, I'm board certified in family medicine and lifestyle medicine. And, I do bread and butter, general medicine, seeing from young kids to young adults to adults to geriatrics and elderly population. And antibiotics is synonymously known to just be a kind of almost like a catch-all of an anti-infectious agent, an anti-infectious drug to pretty much treat everything. And, without understanding the basic microbiology, people who are not in the healthcare or medicine field won't really understand. And so viruses are in a class of their own, bacteria are in a class of their own, parasites, fungus are in a class of their own. And just to talk about, more viruses itself, going off of what Dr. Graham is talking about is particularly the coronavirus, they need a living host. So it's almost similar to like a parasite where they need to attach themselves, to a living host in order to inject their genetic material, and there's many different types. You have DNA, you have RNA, but for the coronavirus, it's an RNA virus, like, Rob is saying, and they need to inject their genetic material in order to multiply and essentially, quote unquote, take over the host. And what pretty much, what pretty much determines who's going to win in this kind of quote unquote battle and internal war is depending on that immune system, right? The immune system, 2/3 of our immune system, for those of you who don't know, actually lives in our gut. And so we're going to talk about this a little bit more, but that's why gut health is super important in terms of, maintaining and enhancing and optimizing in order to protect yourself. And, Rob was, correct, for those of us that are more aging, 60 and above, for those of us that have a poor immune system, for example, diabetes, chronic, cardiovascular disease, respiratory illnesses. That's why they're affected more. But we're actually seeing, because it's a novel virus, we're actually seeing more and more cases in the younger population. I think in New York, which is now the new epicenter, 5% of the world cases, 55% of them are actually from 18 to 49, is what I heard 2 days ago.
Yeah, I don't know if you just heard breaking news within the last hour and a half, maybe. An 18-year-old kid in your neck of the woods recently just passed.
Yeah.
Right. So that's something that, if we have people that are less than 40 listening, it was driving me crazy. And, and last week when I was speaking to the city officials of New York, on my Instagram and my Facebook and any way I can, my newsletters, was a really simple thing. It's just to stay freaking home. Stay effing home. That's it's like, we're not asking you to go to war like we did back in the day during World War
Right.
I. We're telling you to sit on your ass, stay home, and wait for the wave of this infection to go through. That's it. That's all you have to do. That's all we're asking. But, you saw pictures of this, this weekend. I live near Central Park, and one of my friends who is a volunteer park ranger at Central Park, he called me because he was appalled to see how many people were just enjoying a beautiful 65-degree day here in New York City, in the midst of this epicenter, and then the knuckleheads down in Miami, in Florida, hanging out, spring breaking, and as you see, what's happening in the past, probably the last 3 or 4 days, is that Florida has exploded, and I think what's happened. And again, using my hat as a public health official here, this virus entered New York not on March 10th, but probably in late February, early March. And again, asymptomatic carriers, people who don't have symptoms, were spreading it. And most of them are young millennials. And they went down to Miami and Florida and partied. And as you know, in Florida, what you brought up, Colin, is that there's an elderly population down there. And that's why we're seeing, and that's what Dr. Bricks today on TV said, is that now we're starting to see an epidemic or explosion, a new hotbed on Long Island. And so what New Yorkers are doing, they're getting out of town and they're going back. It's the same thing that happened in Italy. We had a conversation with a friend of mine from England who watches the BBC, and they predict that the reason why Italy has suffered so greatly is because most of the industry and schools are from the north of Italy. And they closed northern Italy. And as the culture of Italians are, they live multi-generationally in their homes. And so that infected kid or young adult went down south and infected their entire house. And that's why we saw a little staggering of the death rate outside of the northern part of Italy.
Right. Yeah. So it's very interesting when you're looking at different regions. I definitely want to acknowledge for our listeners that are coming in, shout out to Paige and shout out to, I think this person just typed in their username, but thank you so much for listening in. You're on air on Thrive Bites, and we're talking about the COVID-19 series. So thank you for listening in. I wanted to say that it's interesting when you're looking at different pockets, right? China obviously came from, Wuhan, and as of a few days ago, they've reported really, really least amount, I think 0, if not 1 or 2 cases of new actual cases of active cases. And they actually had to close down hospitals because there wasn't enough patients to support it, right? Why? Can you speak to why, why is there decreasing amount of new cases and why we are having increasing amount of cases over here?
Well, I think it's how the nature of the spreading happens. And so, before we go into that, Colin, I think it's also important to realize that they've actually seen a recent increase in China from people who now come back, getting to your same point.
Yeah.
It's people that are potentially asymptomatic carriers that can infect others. And that's why social, and I like to call it physical distancing instead of social distancing, because that's something we should talk about as well, because I think there's an epidemic of isolation and loneliness that's happening prior to this, which is now just big magnitude, And, I know we want to talk the second half of this kind of conversation on the fact that, we have to take care of oneself. With Fresh, we always say that healthcare is self-care is the best form of healthcare, and no better time to get into that at this point. And going back to your point about immunity, I remember back in medical school, but even in elementary and middle school, we learned about petri dishes. We put some sort of bacteria or some sort of fungus on some petri dish, which is a growing medium. And that's really what we're talking here, right? And that's why people with weakened immune systems are able to grow this like fire, because their immune system has been diminished. And they're a very hotbed. Think about it with petri dish. They're a horrible host, horrible petri dish. And so we're starting to see that back in China, that with forcing social distancing or physical distancing was probably their best, really rudimentary, right? Public health point of view, like washing your hands, other things that are really seeing. These are not the big medications that are saving people's lives. It's really these rudimentary public health initiatives like wearing seatbelts, things like that really save lives more than any sort of medication.
Right.
Self-care really comes into play.
Yeah, definitely. Yeah, for those of you that are listening, just joining in, again, we are reemphasizing of how this actually works, in terms of how it's spread, transmission-wise, aerosolized droplets, right? When you cough and sneeze, a lot of that stuff that comes out is actually traveling The last time I looked at it was probably like 50 or 60 miles per hour. And it just literally just floats in the air and then softly lands on any type of surface, right? And like we talked about before, it needs a living host in order to spread its genetic material. But how does it do that? So when we don't wash our hands or we don't wear masks, what we're essentially doing is that you're touching, the actual virus. And then we're also scratching our face, wiping our mouths, sniffling, rubbing our noses and, rubbing our eyes. And that's how it gets into us, right? Those are called mucosal surfaces, and that's how it gets into us. And, and a point about the young millennials and the ones that are, asymptomatic carriers or having no symptoms, what we're actually saying is that they may actually have it without testing. They may even have a mild course of it, right? Kind of like a seasonal flu, right? But the thing is that if they are carriers, which we also call vectors, they can easily spread it to other people that have poor immune systems. That's the reason why there's new cases in Florida, because Florida is known to harbor a larger senior population. And when you have spring breakers, for example, that are just, running around, touching everyone and, not practicing physical distancing, like you're saying, Rob, it's spreading, and so that's why I want to reiterate to other people that physical distance, not just social distancing, is super, super important. So, hey guys, we're going to be taking a short break, but don't go anywhere. We'll be right back. Welcome back to Thrive Bites. Let's get back to the interview.
I think a couple of things from like what they call migration is what happened is I saw on TV, and this is not about politics or anything, but we start seeing certain statements that, political officials make, like our president and others, that are, I think that they're really well intended, but misinformed. And I think what I saw when you start seeing these, everyone get back to America. Did you see that, Colin? Did you see how many people, millions of people, thousands of people were crowded in airports in China and Italy and all over the world, coming into 13 hotspots? And guess where two of them were? Right where you and I live. One is LAX and one is JFK. And then on top of that, so now all those people where the recommendation from the host country was to socially distance, now they're being corralled into customs. And I was like, holy shit, this is going to be horrible. And then on top of that, you think about New York and you start seeing that the snowbirds, if they came back, they headed back down south, boom, all it takes, and that's it, man. That's how thing just blew up,
And the thing is that I want to add to your point is that, one of the reasons, why China's been effective in terms of lowering the amount of new active cases is because they literally put the entire country on lockdown. Whereas the US, we've been late on this and, two states at a time, 3 states at a time, we're not aligned with each other in terms of locking the entire country down. So what you're doing is that you're mitigating the risk, you're decreasing the amount of transition, but over a longer period of time until the actual states can say, hey, we need to lock things down. And that's why there's more and more new cases, and we just started rolling out new testing or more testing. And it's just not happening fast enough. And, we just needed this to happen 2-3 months ago when it needed to be taken more seriously so people can not die needlessly like this.
Yeah, and I actually just want to mention 2 things, too. There's an old saying that you're only the strongest, your weakest link. And one of the things that really has this has exposed is that our weak public health system. We really don't have a public health system that is able to mobilize appropriately and in a timely fashion when some sort of public health crisis explodes. And, as a doctor here, that's been doing telemedicine, this morning, I just got to bring this up because this morning I woke up to a patient who I've known for years, and actually through lifestyle medicine, but also through an integrative approach, she's been able to put her lupus in remission, using Plaquenil, hydroxychloroquine. And this morning, literally hysterical, crying that she called her pharmacy. She called me about a week ago to get a refill, and I assumed that she just refilled it, but she was unable to find it. And so she started calling her CVS, her Duane Reade, her mom and pops, everywhere, and she can't find it. Now, it could be because, people are hoarding it, but again, this is to the docs out there, is that it's a prescription, so they could only get it from us, number one. Number two, I also heard that the government is stockpiling it because of these clinical trials and for the potential explosion of it. So that's something I just want to mention too, is that, believe me, she needs it now, and we may need it, from our listeners out there. But I just want to be mindful of the fact that, people are suffering today with these diseases like lupus and rheumatoid arthritis, where Plaquenil and hydroxychloroquine have been lifesavers. And I think it's really selfish to think about it that way. The other part I want to mention is that, I'm sorry I'm going off on a riff here, but
it's okay.
Things that really, tick me off that I've been hearing about is that, for example, last week, a patient called who taught, she's a fitness instructor. She's 72 years old. She teaches silver sneakers. She's the cutest thing. And she called because she's been laid off. And obviously, without a job in America, our insurance, our health insurance, and medical coverage are tied to our jobs. And now without a job, she went from being covered to having no coverage. And now we can always argue the fact that there is a stimulus bill and everything else, and it's till the end of the month. But the reality is this: she has asthma, she has lung disease, and she needs to go fill her Advair. Her Advair is no longer covered because she doesn't have health insurance, and she ended up having to pay $256 for a woman who's 72 years old, who still was working, vibrant, and now this is another issue, right? That our healthcare is tied to our jobs, and I've been a fan of healthcare reform for probably 20 years. I'm not saying there's any right plan, any right way to do it, but clearly when 80 million people are without health insurance, and now people that have lost their jobs due to this have now found themselves without health care, this is really, again, a public health crisis that we have to talk about how, particularly in this year when we're talking about health reform, is that we have to look at some sort of public health insurance plan, public option, Medicare for all, whatever you want to call it, but there has to be some sort of safety net, because somehow we found $6 trillion, right? When we're talking about, healthcare would cost $1 trillion if we would cover everyone. So it's an interesting, unfortunately, weak link in our healthcare system where, this, again, I apologize, but it's just something that I'm hearing about, and I think we have to bring up because really, these are phone calls that shouldn't be happening in the midst of this crisis, but people are calling me about this.
Yeah. And, I just want to acknowledge pretty much our healthcare workers, staff, and providers out there. I don't know for our listeners that are not in the healthcare world, we are desperately hurting for supplies and, staffing and all this other stuff. Just in the last week, when more and more testing was rolling out and more of the lockdown and stay-at-home isolation was being ordered, what you find is that offices are closing down, businesses are closing down, and people are having less and less options to go to. So what they'll do is that they will crowd the ERs and hospitals with any type of symptom, whether it's like a fever, cough, or shortness of breath. And it's hard, to be able to decipher any of that. And the testing, we don't even know if it's, really, really accurate or not. I know just recently they just rolled out with a 45-minute testing that's going to be implemented in ERs and hospitals. But, what hospitals we're having lack of supplies, right? We're having lack of surgical masks. We're having lack of PPEs, which are personal protective equipment. And, we are not having enough federal help and support in, helping the healthcare system right now, which is really hurting. And so that adds to your point about not just in terms of insurance, but, what happens when we're in a crisis like this, right? And it's basically food for thought about, when the next election comes up, how this is going to all play out. But I want to shift gears a little bit and actually talk about, wellness. And, the title of our series is Staying Well Amongst COVID-19. And for those of you that are hopping on again, thank you for listening. I'm here with Dr. Rob Graham. You're calling out of Brooklyn or Queens? Where are you at right now? Manhattan. Okay. Yeah. And, he is out of his practice is Fresh Med NYC. He's very active on social media, currently doing telemedicine and helping his population right now. So I really thank him for taking the time out to kind of speak. But this series is definitely, the centerpiece is really staying well. And obviously, people who already have a baseline of, emotional health issues, mental health problems like anxiety, depression, obviously is going to be amplified with all this. Where do we start in terms of, giving advice in terms of how to look at our current crises right now and how to reframe it, right? How to reshift one's perspective in terms of how to look at this, because this is obviously unprecedented, for some, or for most unexpected, but it still represents a life's obstacle. It still represents a life's event, similar to someone passing on or like a traumatic event like a car accident, right? But this is something on a larger scale. So I want you to help us start the conversation of like, how do we reframe, this, and how do we get on the path of improving our emotional wellness?
Yeah, it's so important. I'm so glad that we've started almost going down that negative medical way of looking at things. But I think it's important to have that that first half of our conversation about the real issues that are happening on TV and in our real lives. So, but as you know, Colin, this is why we met. We met at Culinary School when where really as important as every other component of well-being, we hook on and we connect on the aspect of food and cooking. But I want to start off by saying that if you haven't followed me on Freshman NYC on Instagram, about yesterday, my mom, who is 81 years old, she heard that healthcare workers needed a mask, surgical mask, or some sort of mask barrier. And so with her crippled arthritic hands, she opened up her sewing machine and started making masks. And she's always taught me, and I think this is a great intro into this, is because she's always has taught us that, she's an immigrant woman from El Salvador who came here and, from one of those shithole countries called El Salvador, that our president likes to call. And she's made it, and she raised two young men. Still call myself young men.
Always, man, always.
Basically, one of her mottos was, "Don't wait for help, you be the help." And I think it's really important. And I think this is where I think we should focus, the next part of our conversation on, is that going back to my point that, with Fresh, we literally spell out a fresh care model for patients and for people. Self-care is the best form of healthcare. And if you don't mind, I'd just like to go through them because I think it's really important to have a refresher, as we call it, and we need a fresh start because, again, we can't wait for others to change us. We have to be the change.
Yeah. Well, before you do that, I want to applaud your mom real quick. So I think she deserves a round of applause. So thank her for us.
Amen. Yeah. And I think, going back to that point that, health is the greatest wealth, by Virgil, I think it's really important to understand that, we can't wait on medicine to help us. We have to be our own kind of advocate and preach and be the healthiest we can because, medicine doesn't do that. It's called a medical insurance card. It's not called a health insurance card. And so, when it comes to our model called Fresh, we often say when it comes to food, eat more plants. But I also like to say, especially during this time, it's if you don't know how to cook, you're at a disadvantage. And I think it's time for us to go back to our roots and get back into the kitchen. And I think that's really an important factor to consider. And I know you have tons of recipes. I know we've actually cooked together, Colin, times. And I think for my brother-in-law, for example, who doesn't know how to cook, he's at a disadvantage. And
why? Let's talk about that. Why is it a disadvantage for preparing your meals at home versus how before coronavirus hit, when we were just basically outsourcing everything? Because honestly, United States of America, I'm a first generation Chinese born American. My parents, came from Southern China and Hong Kong. And, I was blessed with, both of them cooking in the kitchen. But let's talk about why is it at a disadvantage, for people that don't know how to cook?
Well, as we learn in culinary school, right, is that, there's three things that make food taste good: fat, sugar, and salt. Right? Those are the three basic blocks, right? You can argue spices and other things, but fat, sugar, and salt. And, obviously a restaurant is there, and there's a movement going on in terms of health supportive. And that's why we're so blessed to go to a culinary school where, Anne-Marie Colbin, the founder, really focused on health supportive and just not the French cuisine of optimizing flavor by optimizing fat, sugar, and salt. And so therefore, I always believe that if when you cook, you're in control of the ingredients. And I think that's a big component. And especially now where there is this sense of, is it safe to eat out? Is it safe to pick up takeout? Is it safe to eat, prepared foods? I think this is really an important time to start thinking about simple things that you can do in the kitchen to take more control over your health and well-being by determining what you put in your mouth, which goes, again, back to your point that you originally mentioned, that 2/3 of our immune system is in our gut. And what is the greatest influence of our gut health? What we put in it.
Exactly.
And so therefore, I think people who don't know how to cook are suffering. And again, we are a processed food nation. 63% of our foods, our calories consumed, are from processed foods, where I think, there's movements. And again, total full disclosure, I'm working with a company called Performance Kitchen, where we're trying to make all of our frozen meals affordable, accessible, convenient, and tasty by adopting more of a plant-forward approach and minimizing the bad stuff in our diet in America.
Yeah. And I would also like to add to that is that, this is what I tell my patients, for those of you that are hopping on, I practice family medicine. I work in a physician group office type of setting here in Los Angeles. And what I tell my patients is that, when you prepare your own foods at home, what goes into, your food. Okay. And when we're talking about prepare, it goes a long way. We're not expecting people to be, like the celebrity chefs on Food Network or Michelin star chefs. We're not talking about that. We're talking about preparing simple meals with simple ingredients with the least amount of, hassle, right? And the other emphasis I want to put is that, when I teach my patients is that when you're eating out, you're essentially outsourcing, right? You're outsourcing to the takeouts, the deliveries, to the restaurants, to the fast food. Obviously during this pandemic, it's a different story, right? But when you're outsourcing, the point I want to make is that you don't know what goes into your food. You don't know what actually goes in the kitchen. Some companies, some restaurants do the extra mile in terms of, writing up a nutrition facts and what goes into your food, which is great. But at the very least, they're going to be cutting corners and, using the cheapest ingredients, because at the end of the day, they want to save money. And at the end of the day, it's all about making money, right? They're not there to look after your health. So what me and Dr. Rob is saying is that, we have to if you don't know how to cook in the kitchen, you got to learn. There's so many great, tutorials, recipes, videos. Just go on YouTube and just type in any recipe and you'll find something, right? So that's important to know. And, to start in the kitchen. This is literally the best time if you've been putting it off to kind of get started. Hey guys, we're going to be taking a short break, but don't go anywhere. We'll be right back. Welcome back to Thrive Bites. Let's get back to the interview. The next thing I want to talk about is, what about in terms of meditation or yoga or, just simple breathing techniques in terms of, if someone is feeling anxious or is really stressed out or really has a perception that, we can't really control our environment right now.
Yeah, so perfect. Because again, thank you for the layup there, because in the fresh model, the R is relaxation. And so that worked out well. So I think, many people have been, wanting to learn about relaxation, meditation, yoga, get out of your own head, turn off the TV, stop thinking about things. And, the science of mind-body medicine, again, I had the great fortune of studying with those great minds like John Kabat-Zinn and Herbert Benson back in the early 2000s, where we understood that we do have a stress response, but we have an equal and opposite and powerful relaxation response, which is driven by our parasympathetic nervous system. And we all have felt it. It's the thing that, for me, again, going back to cooking, Colin, I find meditation in mise en place. I find meditation in setting up what I'm about to make, in cutting, in knife skills, and in preparation. And that gets me out of my own head. It makes me spend my time. And ultimately, I realize, oh, my God, I've been kind of dicing and chopping and chiffonading for the last 15 minutes. And I'm like, wow, I was just in a flow experience where I tapped into that relaxation response. And then so I think it's really important for people to find that relaxation response. And it could be through meditation, it could through yoga, it could be through poetry. I was just on a podcast last week with someone, great guy named Jeremy Goldberg, who really talks about poetry as medicine. And I think we all know it and we all have felt it. But if you haven't, this is a great time to tap into something that takes your mind away from the chatter, the monkey mind. And so, and again, there's tons of free apps. And what I love, and we promote a lot in our Fresh program, is De-Stress Monday on Instagram. They have great gifts. And again, it's about controlling the breath, controlling the mind, because it'll be about every 3 seconds, there's an intrusive thought that comes in. And so when people often say, I can't meditate, I don't have the attention span, well, we don't. It's a practice. And the more you do it, the
correct. Yeah, definitely. It really is a practice. And, I myself get frustrated, what I'm saying, but, life is, we say that it can be short, but it can also be very long, right? And so it's important to kind of set up these pillars. Dr. Rob Graham, he has this fresh model, right? Every letter represents something different. And, it's important to, emphasize that foundation. This is what I teach my patients all the time, right? And so a part of it is also relationships. I think we're at a time where, we, have a chance, an opportunity. Let's look at the positives from the coronavirus pandemic, an opportunity to rekindle those relationships. I can't tell you in the last week and a half of how many people I called, in terms of old friends, old colleagues that reached out to me, new colleagues that reached out to me in terms of, just making sure that you're okay. Right. And this is interesting because we, before the internet, before social media, we had neighbors, right? We still have neighbors, but neighbors that no longer visit each other, right? I mean, I grew up in, central New Jersey, suburbia. So, I didn't really knew my neighbors growing up, right? And I was born in the early 80s. And my point is that, now with the advent of internet and social media, we have the chance, and the phone, we're forgetting about the phone, we have a chance to bridge that gap, right? So because we are practicing physical distancing, we have to reinforce relationships. There was a Harvard study, I think it was like 70 or 75-year long study, and about happiness, right? And, what they find was that, maintaining and reinforcing those relationships is one of the key factors in terms of, how do we, maintain and, optimize our happiness. And, that's really what it is, emphasizing that, so this gives you an opportunity, whether, you have a poor, family unit or marriage unit or something like that, to be able to, literally, take it to the next level. It doesn't matter where you started, but I think that's important to, take this opportunity to rekindle that.
And 100% absolutely. And a couple of things I want to touch on that is that, my parents are in their 80s, and they have a cell phone, and I called my dad and I said, Dad, hey, listen, instead of answering, press that button that you've never pressed called FaceTime, when I call. And he did. And Colin, it was like, he was like, oh my God, I can see you. And my mother, and it's a great time that, we're all stepping outside of our comfort zones. And I think, for your elder audience right now, is that experiment with FaceTime and Zoom and other platforms that really, I wish, if we can't physically touch and see each other, at least we can do it through using, this sort of media, right now that, from now on, I'm going to FaceTime my parents. I'm not going to just speak to them. I'm going to FaceTime them so I can see them, so I think that's an important factor. And of course, we have in the fresh, we have the E and S, but I just want to jump into what you're talking about, the H, and I think oftentimes the H in our fresh model is happiness. And the great Chris Peterson, one of the founders of positive psychology, which, that's Julie's sweet spot, which he's an expert in. It's summarized in 3 simple words: other people matter. And that's really what's important at this point. Your job, is important, but what really gives us joy and happiness, going back to that study you mentioned from the Harvard study of adult development study, classic one. It's actually a TED Talk as well. That, other people matter. And the fact that just because we're physically distancing ourselves right now, we still can be in touch and we can still connect with others. And, how about back in the day when you used to write a letter?
Yes. Yes. I remember a pen pal. I remember my 3rd grade pen pal, and how it was fantastic to be able to receive it, in, snail mail or the postal service, and to receive that letter and to open up the piece of paper, right? Because pieces of paper are different, where you come from, and the handwriting and everything. It just gave me so many different types of nostalgia and so many different types of feelings in terms of like, wow, I may not see this person in real life, but I was able to connect because this person took the time to actually wrote, a handwritten letter and mail it to me, and, obviously with the internet and email and all that stuff, we've made our lives very automated and very expedited, right? But we have to remind ourselves that, there are the little things that matter the most. And, those are the little things. I mean, my mother, she still, hand writes birthday cards to me. She makes picture collages, of me growing up every single year. So as if I wasn't there. So, but yeah.
I think, and just kudos to your mom too, who's obviously raised a wonderful son, but just an amazing woman in her own right. And I'm wishing her well as well, because I know she's a traditional Chinese medicine doc, and We're all going through a tough time because obviously in medicine, including Chinese medicine, which is one of the original forms of medicine, the human connection and the touching. And, just going back to telemedicine, it's interesting. People are postponing their follow-up appointments because they want to see me. They want
Right.
that connection that fortunately, and it's a blessing as physicians that we have that opportunity to really connect with patients in that very intimate, vulnerable, experience. It's really important. I just want to talk about happiness because I just got to give a shout out to Julie here because she has a book called The ABCs of Positive Psychology. And it really,
Tell the audience who Julie is.
So Julie is my wife of almost 20 years, which our 20-year wedding anniversary.
Yeah.
Yes, we can. It still happens in today's society. We're in a stable, happy relationship. We got married June 5th, 2000, which we were going to go back to Hawaii on June 5th to celebrate. But because of this effing virus, we can't go. So we have to celebrate another way. But she actually did a really cool experiment, and she wrote a book on it. It's on iTunes. And basically, it's based on positive psychology. And I invite all the listeners to go to her Instagram page called Positively Psyched. And she's all about finding her way home. And that's what she really wants people to know, that we have the power to be happy. And she basically, what she did was go through the alphabet, the ABCs, and identify words that have been scientifically proven to optimize your well-being and make you north of neutral, which is one of the pillars of positive psychology. Positive psychology is the science of human and community well-being and what makes communities and people and communities thrive. And it's really a powerful tool that she uses in her health coaching practice because, we all think we want to be happy, but most of us, in fact, are just blah. And think, going north of that neutral is really important, particularly now, because something else she often mentions is that there's always a bless in the mess. And I think this goes back to your point, Colin, is that even during these tough times, we have to find the bless in this mess because that is ultimately what's going to get us through this. And so I think that's something I just wanted to bring up because we often, want the promotion, but, what really makes us happy is the people that we surround ourselves with.
Right.
And for those who are unfortunately surrounding themselves with very toxic people, which I see is happening as well, domestic violence is increasing, child abuse is starting seeing that kind of shit going on. And I think, I pray for those people that we get through this because ultimately that is a reality that we don't want to talk about right now because we are confined into our homes. And sometimes our homes are not our safe spot. And we had the blessing of being raised in a very happy, healthy home life, both of us. But many people don't have that home life.
Yeah, definitely. I had a good friend of mine. She works as a special eds teacher. And when the schools started to close down, she actually started to worry because she knew of a lot of kids, school is actually their haven as opposed to being at home. Not all of us were fortunate enough to be raised by, good intentioned parents. And some of them are alcoholics. Some of them are drug addicts, and if you can imagine not being in school where they have a decent meal or certain resources, counselors, and going back to that environment. So it's it's an unfortunate event that we're facing, and I think globally we are needing to reshift and reframe how we look at different things. And this has definitely changed all of our lives, and I'm hoping in a more positive sense, gives us an opportunity to reflect and kind of look at what we've been doing and kind of see what is it that we could improve on, not just for ourselves, but also for our fellow man, our fellow neighbor, our fellow, friend and family member. Because at the end of the day, we may look different on the outside, but we're all the same on the inside. And guess what? We all live on the same planet. So, climate change has also been, a hot topic. I'm not going to get into that, but, we have to do our part to help each other out and help, the environment that we live on as well. So. Totally.
We can part two. We could talk about how coronavirus could be, related to climate change. I took this class when I was getting my MPH called "The Impact of Climate Change on Human Health," and again, that was back in 2003. When it was called global warming, and everybody thought that Gore was a quack. And it's again thinking about vectors, diseases, that transmitted through vectors, and we're having climate change has a huge impact, and I guarantee you it has a major role in what's happening in today's society. But Colin, I know our time is somewhat limited, but I just wanted to mention the fact that ENS, the exercise and sleep, because oftentimes we think about going to Equinox and going to the fitness gym and going on to what I call the treadmill and the Swearmaster, but oftentimes it's going back to the old school. Guess what I've been doing?
What?
Dips, push-ups, jumping jacks.
Yeah, the basics. No, it's basics. I tell my patients push-ups, pull-ups, right? Squats, lunges, like basic skills, basic, workout skills that work multiple, body parts. And it's simple. You don't need a gym, dumbbells, or even bands. I mean, sure, those are nice, but using your own body resistance. And, it's important to be functional. It's important to continue to move, because that expression is correct. It's like, if you don't move, you lose it. You know what I'm saying? So we have to keep moving. We have to keep thriving. I want to thank you for coming onto the show, Rob. Tell the audience, where they can find you, where they can look you up, and what you're doing right now.
For sure. I just want to finish. If you don't take naps, now's the perfect time to take a nap. Sleep 7 to 8 hours a night. And if you don't do it now, you have the opportunity to. Yeah. So I just want to say thank you. Again, thank you so much. I still practice seeing patients at FreshMed NYC in New York City. Actually, about 4 months ago, we launched a online university called FreshMedU. freshmedu.com. It's all about you. It's all about self-care. It's because people really want to know about the pillars and the ingredients that we talked about. And again, we were about to launch a book called The Fresh Five. We had a phone call with our publisher, Simon & Schuster. And we really want people to take care of themselves, because we can't wait for the government to do it. We have to take care of ourselves now, and we all can do our part. But more importantly than anything, stay home, everyone.
Yeah. Thank you so much. Guys, my name is Colin Zhu. I'm host of the Thrive Bites regular season. This has been our first live show. Thank you so much for listening on. And, we will see you on the next one. We're going to have a next show tomorrow evening. All right. Thanks again, Rob.
Awesome, brother. Anytime. Stay safe, stay well, stay fresh.
Same to all you guys listeners. Thank you so much for listening on. Hey guys, that was another episode of Thrive Bites. If you like that episode, please subscribe and follow weekly for new episodes. And don't forget to rate us on Apple Podcasts.